Hey, hello everyone, and welcome to yet another To Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the To Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health. Do subscribe to our YouTube channel and follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Anupama Savadi. To give you a brief introduction about Dr. Anupama, Dr. Anupama Savadi is a practicing dentist with over 19 years of experience in the field of orthodontics. She is a graduate from the Government Dental College, Bangalore. She has completed her UG and PG from the prestigious Government Dental College, Bangalore. Dr. Anupama was given the Indira Mrutyunjaya Award for scoring the highest marks in orthodontics in BTS. Passing out of her PG in the year 2001, Dr. Anupama has since worked in the field of orthodontics as a private practitioner and a teacher. She is currently a professor at the Department of Orthodontics, Sri Venkateshwara Dental College, Bangalore. Dr. Anupama, with her husband, dentist Dr. Ravindra Savadi, practices at Savadi Dental Care. Dr. Anupama is actively involved with the Rotary Club in contributing to social services. A trained Bharatanatyam dancer and a lovely mother of two, Dr. Anupama celebrates her passion for dentistry with her other interests. Dr. Anupama, thank you so much for joining me today in today's conversation.
Thank you, Dr. Rekha. A very good afternoon to you too and all the viewers watching this. Yeah.
Yes. Ma'am, what is the topic that you would want to share with our patients today?
See, one of the important thing that we notice in early mixed dentition is a lot of crowding. Why don't we discuss today about serial extraction? So the
Okay.
word itself, when we tell serial extraction, not many parents and of course the young patients will know about it. So why
Yes.
don't we talk about serial extraction today?
Yes, sure. So what happens is when we say mixed dentition period is the time when the child has both his milk teeth and his adult teeth that are present in the mouth at the same time. So this probably is the time range you would say between 6 and 12 years the child is in.
It starts from 7 years because that is the age when we see the central, that is the front tooth, central and the lateral incisor, both the upper and the lower that start erupting. For some children, it might be as young as 6.5 years to 7 years when they start erupting along with the first molars. Yeah. So
Yeah.
this is the age group where it's very important because sometimes the milk tooth falls off and then the permanent teeth are crowded, but sometimes the milk tooth is just shaking and the permanent teeth is coming either behind it or in front of it. So these patients we have to monitor.
Morning.
So
Yes.
they fall in the age group of 6.5 to 7 years when
Yes.
we can take a decision or a call regarding whether serial extraction is necessary.
So what exactly is serial extraction? What is it that exactly you plan in a serial extraction?
See, when we define or explain about serial extraction, it is a planned, a sequence extraction or tooth removal of some milk teeth and permanent tooth as and when required. So mainly this is done in cases where very severe crowding is there in each arch. Like say we require about 10 millimeter of space. Those are the cases we plan for serial extraction. So what we do, we remove some milk teeth even before they fall so that the coming permanent tooth erupts in the proper position. Yes.
So this is something that is planned very much when the child is just entering the mixed dentition phase.
Yes, yes. So what happens, like we come to know that the milk tooth is shaking and the permanent size of the tooth is very huge. So one central incisor in the lower has come out and we require that it is almost occupying 1.5 the space of a milk teeth. And the milk teeth, there are so many, this is trying to fit in somewhere. See, generally teeth are also like the passengers in a bus. So if you have a seat, you will very nicely go and sit there. Otherwise, we are all crowded, cramped,
Okay,
and you
adjustment.
feel teeth all over the place. So the idea of the serial extraction to remove the milk tooth even before it falls is the idea that the tooth, the permanent tooth, comes into the keratinized tissue. Otherwise, what happens? If the milk tooth is still there, the space is not adequate. It might come behind or front,
Or
where
maybe
it
rotated
is
also.
rotated also, and they will not have enough good alveolar bone support.
Ah.
And if you just allow it to be like this, probably you're looking at poor oral hygiene for the patient till the all the permanent teeth erupt where
Yes.
food is getting stuck. And some patients, if the upper front teeth is crisscross overlapping, one, maintenance of hygiene is poor. Second, they might suffer from a very poor self-esteem. They might not even smile. Most of the children, you can see them, they're keeping their lips closed. If you tell smile, they're like, no, I don't smile that often. That's because they're trying to hide it. They don't want to smile at all.
Yes.
So giving them a good alignment at this phase of life, when they are that younger mixed dentition age, one, they'll be able to maintain the permanent teeth as and when they come. Second, they can enjoy their social life and even the school life, smile, talk confidently, and that is what we desire from every
Yes.
child, for
Yes.
them to enjoy their studies, play, and a good social interaction, and they should be happy. This is what we expect from the children.
So, ma'am, you said that a child which you feel has space deficiency of say 10 millimeters is when you would plan a serial extraction. So, how exactly would you come to a conclusion that this child has that kind of deficiency or might have that kind of deficiency in the next couple of years' time?
Yeah. Sometimes the appearance, if suppose one milk tooth has fallen off, the permanent teeth or the central permanent incisor that comes in the very front ear or the upper, when that is erupting, it erupts behind, because there is another milk tooth and this is almost 1.5 the size. When you look at the arch and the tooth size, you already know there is a lot of discrepancy. Then we have our intraoral periapical radiographs, that is the x-rays, small x-rays. Then we have the OPG, the x-ray to see all the set of complement teeth, where we can see the permanent teeth below the milk teeth, as in a OPG. Otherwise, we can take small radiographs in the lower arch, in the upper arch. We can measure the tooth size and what is the arch length. That is, what is the length of the bone from one molar to another, and what is the size of the teeth. If you know that your teeth size is more than your arch length, right? If your arch is like an arc, the teeth should also comparatively be in harmony with your arch length. When you measure and note down your arch length, you come to know that there is a discrepancy, say about 10 millimeters, then definitely they are ideal patients for serial extraction.
So, that means to say, ma'am, that when the parents see that the child's first milk tooth is about to fall off and he's getting his first adult tooth, that is in the front, that would be the ideal time for them to take their child to a more specifically an orthodontist, just to ensure that there is no crowding that will happen in the future.
Yes. See, we tell that, the first visit to a dentist or even like a general dentist should be when the first tooth is visible. So that can happen even when all the set complement of milk teeth are there. Once that is done, everything is going normally. The next major checkup comes when the permanent teeth are erupting. So better to meet an orthodontist. Otherwise, if they meet a general dentist too, it will be the duty of the general dentist to get it under the checkup of an orthodontist to see that things go well. Usually at around 6.5 years, 7 years, when you plan for removal of the milk tooth, in the cases that is required, after that 1 to 2 years, they are okay till your canines come out. Then in these cases which have about 10 millimeter, discrepancy, or where you want 10 millimeter, we also extract the first permanent premolar. Okay, and we see that the canine comes in that position. So usually it is 6.5, 7 years, then 1 to 2 years, they are okay. And then again, you might have to take a decision regarding extraction of the permanent tooth. So ideally, it would be when the permanent incisors are coming in the upper and the lower arch, at least once in 3 months or once in 6 months checkup, as advised by the orthodontist, then at least once in 6 months checkup till the permanent teeth come into position.
So that means to say that during this phase, when selective teeth are removed and allowing the tooth to come into its place, there would be no appliance as such that will be given to the child.
See, sometimes there are different schools of thought. Some people believe that expansion is the answer, and then you do the expansion so as to allow the entire permanent teeth to set. But not all the cases it is possible. Where the discrepancy is little less, probably you can go for expanders, make space. But then in cases where the bite is ideal, the occlusion is good, there is no cross bite, then it doesn't serve to do a expansion in the upper arch. Then teeth can go into a different kind of bite problems, right? So in those cases where the discrepancy is severe, say about 10 millimeter, and there is no jaw abnormality, we don't advise serial extraction in the jaws which are there is abnormalities where the maxilla is very protruded, mandible is retrusive, or mandible is in a reverse bite. So if there is no jaw abnormalities, severe crowding, where the discrepancy or the space that is required is about 10 millimeter, then of course in these cases we can do. So just to give a brief outline about which tooth are extracted, the milk tooth are generally, it is the incisors milk tooth. Then there are different, like milk tooth canine is removed. Then you will even remove the primary first molar, that is the milk tooth first molar, so as to promote the first premolar to come out before the canine, and then you will go for extraction of one permanent tooth in one quadrant and allow the canine to set in position. So this is the sequence of extraction. Probably for a person who is not a dentist listening to all this, it might look, of course, when we see the case, we will advise, and it's not that at one shot all the teeth are removed. So they need not panic. It will very neatly be explained, and on consent only serial extraction will be done. So we will explain what is the necessity. We can show cases like how, they feel miraculously the teeth are decrowded. They are arranging so well in position without any appliances. Yes.
So, ma'am, what happens after probably a child? Supposedly there is a requirement for a child to undergo serial extraction. So, after all this is done, would there be a requirement again for some kind of a clip treatment at a later date?
See, before it was believed that, okay, 10 millimeter discrepancy, teeth will, canine will move to the position distally. Some amount of space is lost by the permanent teeth, second premolar coming near the canine, and self-adjustment. So they might not require fixed orthodontic braces at all. But now serial extraction is an adjunct, a supporting treatment rather than a whole treatment within itself. Because what do we want in cases for stability is a root parallelism. Root parallelism is to be one next to each other, to be parallel. Suppose when you do serial extraction, there is self-drifting of teeth, and they might be like this. We would like to align well with the orthodontic treatment. Sometimes the whole space might not be closed up on drifting itself. So all these remaining mild spaces, root parallelism, ideal alignment would all be done with a braces treatment. And some believe, that if the tooth is severely rotated, it will not completely correct with serial extraction. It might come to a better position, but an ideal alignment can be given only with orthodontic braces.
So we did talk, ma'am, about what are the indications or what would be the requirement for a very planned tooth removal in children. So, what situation would call for that we don't do a serial extraction, that we don't do this
See,
kind of extraction?
yeah. Since serial extraction is planned in very young children, like they are in the early mixed dentition, cooperation of the patient is the foremost. First, the child should understand that it is being done for a purpose, for the benefit of the child. Sometimes very uncooperative patient doing it on the dental chair in the dental clinic will not be possible. They might require some assisted means, or in a hospital. So it is the complete decision of the parent to take whether they will go to that kind of facility and get the extraction done. But if it's a cooperative patient, severe crowding, the young patient understands why it is done, the parent also gives the consent, definitely serial extraction can be done. Second is the jaw's abnormality. As I explained, the upper jaw is way forward, as in a class 2, or there is a reverse bite with the lower jaw, way forward. We avoid serial extraction in cases with jaw abnormalities. Other than that, as I explained, what are the situations in which it can be done? It can be done. Yes.
Dr. Anupama, thank you so much for sharing with our patients and our viewers this particular aspect of clip treatment, because I think most of them are thinking that I should take my child when the child is 12 years, 13 years, to the orthodontist and get a correction done. Because I think so many times so much space is lost, during that mixed dentition phase, which could possibly be utilized at a later date to give a better smile to the patients. And I really hope our patients do understand this and make it a habit to take their child probably, at the 6th year, when permanent teeth start erupting, and get talk to their dentist about this aspect. Especially, I think if parents themselves have had a crowded teeth in their younger days, I think it becomes more important.
Yes. Genetically, the children will be more susceptible.
Yes.
Yeah.
Yes.
See, also introducing the child for regular checkups, some treatment also make them be aware of their teeth, the hygiene, and even you can see them so confidently smiling, maintain their dental hygiene. They are not scared of dentists. I think they are very well balanced. So introducing from a very younger age also helps the child also to know about the various treatment facilities and why it is being done. Definitely. And happy child always usually
I
turns
know.
to happy adult,
I know.
and a balanced adult, and
Yeah.
that is what we want.
So, Dr. Anupama, thank you so much for joining me today in this Tooth Talk conversation. And I really hope I can get you back on this program to tell our viewers more about, chip treatment and more aspects and more advanced treatment options that are available to our patients.
Yes, definitely we will do it in the successive talks and all that. And I hope whatever we spoke today was informative. I know some things look very technical, but words are words. I have to use incisors, front tooth, at least to some extent. If there is any doubts, they can always get back. Yeah.
Yes, sure.
Thank you.
Sure. Thank you so much, ma'am. So that was Dr. Anupama Savadi, who did talk to us about the various aspects or concepts that are available in clip treatment. I hope you like the video. Please do click on the like button and share the video with your friends. And do subscribe to our channel and follow us on Facebook, Instagram, Twitter, and on Telegram. Do visit our website www.thedentaire.com to get more information about your dental health. So until next time that I come back with another dentist with another topic on your dental health, keep smiling and be happy. Thank you.